It's really been a great year here, last 10 years here at UCSF in the Diabetes Center. When I came back in 2000, there was a real interest in trying to take our research, our education, and our clinical care to the next level. We've had a lot of successes in these areas. In the clinical research area, we've been able to actually start many clinical trials to test novel therapies in patients with type 1 diabetes and type 2 diabetes. Specifically, we've developed drugs that can now halt or at least slow down the progression of type 1 diabetes by impacting on the immune system, changing the fundamental aspects of how the immune system recognizes and destroys these critical insulin-producing cells. It's been an effort that's required a lot of work by the faculty, by the staff, and by the clinicians to make sure that we're taking the best treatments forward. We've started an islet transplant program, one of the first in the country, and now I would argue one of the best in the country. We've also did fundamental research now in stem cell biology, really starting to take these human embryonic stem cells and convert them from an immature, undifferentiated cell into a cell that can make insulin and be used in patients with type 1 diabetes or even some with type 2 diabetes. One of the greatest challenges for type 1 diabetes and type 2 diabetes is really understanding the most fundamental aspects of what causes the disease and the biology around the pancreas and islets themselves. I see us really moving more directly in this area, really trying to get at the fundamental processes that determine why the immune system destroys beta cells in some people and not in others, and why some patients become type 2 diabetic. So I think going forward, the creation of mobile health applications, being able capacity building in the community, getting people out in the community who can translate the information in the courses out there is really something I'd like to see happen over the next decade. Every day, I think there are exciting opportunities in diabetes research. The exciting opportunities of being able to recreate an insulin-producing cell in a petri dish that can be given to people and correct their disease would be incredibly exciting. The ability to identify a 2-year-old child who will get diabetes 3 years in the future before they get it and be able to treat them with a drug for a short period of time and have a long-lasting impact and they don't get disease, that would be exciting. Being able to understand the basic processes by which the body is not able to respond to the insulin that's being made in people who have type 2 diabetes. If we could understand how fat works and we could understand how muscle works, that would be exciting. So every day there are exciting things to be able to do. But at the end of the day, the most exciting thing would be to be able to go into an office with a parent and a child and tell them that we have something we can do that will change this disease for them.